Death is the worst thing which can happen to anyone, okay? But actually, stroke is worse than that.
That's why they say that, you shouldn't fight in front of your kids.
It releases so much of stress hormones into the kids and it causes a major inflammatory damage to the brain cells.
What do you think are common habits that we are destroying the brain activity?
Detox is a word. Everybody is using it and actually misusing it.
He's working at US times and sleeping only like 5-6 hours a day.
Yeah.
What will happen if you keep on doing that for like a year or two?
You will start declining in your career itself. Women's, most of them who are in the reproductive age group, they get into the infertility groups.
A neighbor or a family member,
Yeah.
how do we identify if a patient is going through this?
Your brain will not be able to pick the objects and it will see as correct, but when it is coming as an output, it will be totally opposite.
So you look at the mic and you say it's a car.
Car, yeah.
So when a patient is seizing or having seizures, it's a common practice to give the keys.
Key, that is in the 70s and 80s movie.
What does alcohol do to the brain?
They say, I'm in total control, but 90% of them, they'll cross beyond.
Cracking your neck can cause stroke.
Massage center, chiropractic centers, where they would have suddenly cracked the neck and they would have been paralyzed.
Before we dive in, can I be honest with you? It blows my mind that 57.9% of you who listen regularly still have not subscribed to our channel. If you enjoy the podcast, the stories, the science, maybe even laugh at our jokes, could you do us a small favor? Hit that subscribe button. It takes only 2 seconds and helps us keep bringing you better guests and episodes every week. I'm truly blessed to have all your support and I'm sure you will support me in the journey. Now, let's get into today's episode.
Hi, Dr. Karthikeyan. Thank you so much for being in the podcast.
Thank you.
I'm more than excited to be here with you because I want to really get deep into the anatomy of the brain and how we can shape the brain according to what we want. Okay, and
Superb.
You are an expert in neurosurgery. You open up brains. So we want to know everything about brain through you. Okay, so the first question that we have is, what is right brain? What is left brain?
For a general audience, what do I say is, your left brain controls your right half of the body, whereas your right brain controls your left half of the body.
So, for example, my right hand is controlled by my left brain.
Left brain. And your right brain controls your left side of the body, both your hands as well as your legs. And your language center, like how do you communicate, everything is placed on the left side of the brain. Okay. Whereas right side of the brain, it's more of analytical and your creativity. Your creativity part starts from the right side of the brain. So that's how these two centers have been separated.
So left-handers being creative is
Yeah.
something that we hear all the time.
Definitely.
Is it because left hand is being controlled by the right side?
Right dominant. Yeah, exactly. That is why they tend, that's why we always, during our childhood, they try to restrict, do not write in the left hand.
Yes.
Do not do something in your left hand.
Correct.
Do not lift in your left hand. Do not give something, any gift on the left hand. Never do that. You never teach your kids to do that, like, restrict your kids to stop doing in your left. Never do that. Because once they start doing it, your right brain becomes dominant. And the creativity also, it is spontaneous. And you're actually inhibiting in the very younger stage itself. So never do that. So see, we have a situation, we are not supposed to receive gift on the left hand.
Yes.
That's basically, it's a myth. So, and what they say is like, we should eat only on the right hand.
Yes.
The left hand is for some other purpose.
Correct.
As if it is something which is like antisocial.
Yeah.
They are antisocialing the left hand. No, it is not like that. You can do on both hands whatever you want.
So the more we do with left hand, if you're right-handed,
Yeah.
that is better for your creativity.
Yeah, definitely.
My kid, he
Yeah.
eats with both hands.
Please allow them. Do not stop them. Do not ever do that at any age group, and observe them which hand is getting dominant over writing, eating. See which is getting dominant and allow them to take that role.
Be spontaneous.
We are spontaneous. Never stop them.
How about the ambidextrous? People are doing both hands.
Beautiful. It's very beautiful. It's like you've been balanced on the both the sides. Never stop it.
Wow, nice. So when a person gets married, when the woman comes into the house, they take the right leg.
Yeah.
They should take both legs at the same time.
Definitely.
How is the brain different for a man and a woman? You want to call your wife? I really want to understand the anatomy. Is it bigger, smaller?
No, it is the same.
Same.
They make it complex while they are growing.
So is it scientifically, is there any, how they process emotions?
No, actually the emotions are pretty similar to all the brains. But what happens is like it is the social structure and what the process it's ongoing from the childhood days, it takes over. It is not different from the birth itself. It's what's the social elements which adds to this. Then those parts will take over. So see, basically all the skills what they are learning, it is not started right from your birth itself. You have a definite structure, and over the period of years the neuron networking keeps developing. And over a period of time it keeps integrating and keeps learning new stuff, and with all the social every activity it's just like a computer. All the process is being recorded over there
And processed
and it keeps
executed.
executed.
See, that is why childhood trauma plays a major role.
Very. See, the intellectual and the personality plus how much, either it can be your career wise, your emotional liability, everything plays on the childhood trauma.
Is that why they say that you shouldn't fight in front of your kids?
Definitely. It releases so much of stress hormones into the kids, and it causes a major inflammatory damage to the brain cells. That is why and it's like a mirror, okay, and it's not yet processed. It's like in a middle of a process, okay. See, imagine you are cooking a beautiful food or something which is happening, okay, and it is in the middle of the process. Suddenly you put too much of masala into it. What will happen to it? It will get spoiled. The same way, when they are undergoing through a sudden trauma and those things, the development itself will get delayed.
Wow.
So
what are all the possible childhood traumas that you see in your practice? I know about the parents fighting in front of the kids and abusing
each other, parental abuse, and
what do you mean by parental abuse? Parent hitting the kid?
Definitely. And
but as 90s kid, we grew up when they hit us.
Yeah, but I'm talking about a trauma. There is a thin difference between controlling the child and traumatizing the child. There is always a thin line. See, I can control you to a certain extent so that you do not do certain stuff. But at the same time, I cannot traumatize you by doing that stuff. There is a very thin difference. You traumatize, you can never recover from that.
Wow, that's deep. That's deep. In your practice, what do you think are common habits that we are destroying the brain activity in adults?
Sleeping late.
So sleep plays a major role.
Plays a very major role. See, we now everybody, like, you drink this, you will be detoxed. You drink that, you will be detoxed. Detox is a word. Everybody is using it and actually misusing it. Most of the food products, you take this, you will be detoxed. But our whole body parts detox themselves. By themselves. Correct. You don't need anything outside to detox.
Correct. That is why there is an organ to detox.
Okay. And for the brain to detox, the only time it detoxes is in sleep. Okay. So, and most of the chemicals which is being active gets into the sleeping mode during sleep. And when you are awake, all these active chemicals, again, it will not be depleted. It will not come to zero level.
Okay, so it will be still active.
It will be still active. And these chemicals will again harm the brain. That is why sleep plays a major role in your adult activity. And
So let me ask you. So let's say a patient comes to you,
Yeah.
and then he's working at US times, and
Yeah.
he's sleeping only like 5-6 hours a day.
Yeah.
What will happen if we keep on doing that for like a year or two?
See, till the age of under 30, it will get adopted. Okay, it will get adopted.
Your body will be able to adjust.
Yeah, adjust to it, and even your brain gets adjusted to it. After a period of age of 30 years, and you followed this routine for example 5 years or 6 years, what happens? You will start declining in your career itself.
Because your productivity goes down. Because
Drastically.
the signals goes down.
Everything goes down. See what happens. See, you cannot tell your brain to secrete the hormone cortisol in the night. It has to be secreted in the morning.
So there is
for your activity.
So there's a time for every hormone to be secreted.
Every hormones to be secreted. You cannot train your brain to secrete, because it's been billions of years back. This has been.
Correct.
It's like a computer. Our brain is like a computer which has been processed billions of years ago.
Correct.
And we start developing new things into the brain as the years added on. And now you cannot change the motherboard now. Correct. Now you don't ask the brain to secrete the morning hormones in the night and the night hormones in the morning, and everything totally changes. And these hormones and the chemicals plays a major role in our day-to-day activities.
You're talking about circadian rhythm. So we have to stick to it.
Exactly.
A person listening to this podcast.
Okay.
Let's say that they are sleeping late.
Okay.
What do you mean by sleeping late? What is the right time to sleep?
See, my ideal time. See, in the city, we have to be very practical.
Correct.
See, we cannot say go to the our ancestor state where sleep at 6 o'clock or 7 o'clock,
Correct.
which is not at all possible.
Yeah.
At least a person or any average working person can sleep at 10 o'clock. 10 o'clock is what we advise. So beyond that, it makes the present situations worse. So 10 o'clock to morning 4:30, 5 o'clock is adequate. That's what we advise. Beyond that, see, most of them, what they do is
They sleep at 12.
12 is becoming more common. Even though their work finishes by 8 or 9, they make sure it extends to 12, thinking that it's normal.
Because that is their me time.
Yeah. The me time is actually, sleeping time is the best me time.
Me time. So you need to prioritize sleep over everything else.
Everything else. So most of the people think me time by scrolling
Correct.
phones and having a heated conversation or whatever conversation will give a me time. Actually, that is the worst time.
So I tell my patient is that I am a sleep professional.
Okay.
I am a professional sleeper.
Okay.
Which means that I prioritize sleep over everything else.
Yeah.
So for example, if I have to catch a flight, I don't do red eye. I don't do overnight. Even though it is expensive to travel during the day, I prioritize sleep over everything else.
Right now you're staying in US and people over here, Indian corporates, are working for US.
Correct. Correct.
And most of them I'll be doing what you're doing in the day. So this
is a very important point. Okay.
Yeah.
You are being a neurosurgeon. I'm going to picturize a patient that I saw.
Okay.
So this patient kept on working at the US time. Okay. So especially California time is really the worst.
Oh.
Because it's exactly 12 hours almost around.
Okay.
So let's say 8 p.m. over here would be 8 a.m. over there.
Exactly.
Okay. So they need to work from 8 a.m. to 5 p.m. over there.
Yeah.
So they will have to work from 8 p.m. to 5 a.m. over here. Okay, so that is the worst time. So this patient kept on working like this for like 5-6 years.
Okay.
And developed blood pressure. Okay, that was a first indication. And after 5 years, because he couldn't change the job and everything, the blood pressure was uncontrolled and the blood vessels ruptured and he came in with stroke. This was 35-36 years. Have you seen similar situations in your practice?
So many patients are like that. See,
Oh my God.
We talk about most of our studies are from West, correct?
Correct.
And nowadays, I'm seeing these set of patients under 40 are in the percentage of 40 to 50%.
Wow.
See, out of 100, above the age of 60 to 70 was on the higher limit. Now it is coming closer to 40%.
Wow.
Meaning, this is the major indicator that it is changing towards the
The lifestyle disorder.
Lifestyle disorder. So the major concern is the sleep. And they do not complain about it. They rather think it is normal. It is normal that I can work in the day and I can compensate, work in the night and compensate in the day. No, your brain doesn't work like that. And your body doesn't work like that. And as you, the other side of the cycle is the female part.
What happens in women?
Women's, most of them who are in the reproductive age group, they get into the infertility groups where they get into the morbid obesity, blood pressure will be starting, polycystic ovary disease and the infertility issues, and again back to stress, blood pressure mounts, and it will be like a vicious cycle. They will be into the vicious cycle, and at one point it will lead to a end organ damage.
So explain to our audience what is end organ damage and why blood pressure is a problem on a long-term basis. People talk about diabetes as a bigger problem.
Exactly.
But blood pressure is a killer disease as well.
See, blood pressure is something which everybody is awake and it is required for every normal human being.
Correct.
See, every patient, what they'll say, I have a pressure. Pressure is normal. Pressure should not be treated.
Yes.
It is normal for you to be awake, for you to run, for you to work.
Talk.
Everything you need a pressure. You need the blood to be pumped to your organs. But what happens is like, once you are falling into a category where you have a sleep deprivation for a long time and you have not slept. What happens? The normal stress hormones, which has to be released only during stress, will be normal for you. And these stress hormones will be always high on your side. Without your realization, suddenly your blood pressure will be 140, 150, 160. Suddenly what will happen? Your company will have a project and you have a deadline that you need to complete this amount of time. And you never been checked your blood pressure thinking that you are being normal and you haven't checked your blood pressure for a long time. Suddenly what happens? This stress level mounts suddenly. And this blood pressure and your brain arteries are like 3 millimeter, 2 millimeters. Okay. What happens? Suddenly, when your blood pressure rises, there is a gush of blood going into these tiny arteries. What will happen? For a certain point, it will sustain it. And suddenly, when the blood pressure rises, these arteries cannot sustain it. They'll rupture.
When you say rupture, it'll burst open.
Burst open. And the entire brain tissue, there will be a damage.
Which means blood.
Blood.
So the blood which is supposed to be inside the blood vessel will rupture and the blood will be in the brain.
Brain surface. So that is when this is called as, this is an end organ. So the blood supply is totally cut and it is totally damaged.
And what is the youngest age that you have seen?
As early as 24.
24?
24.
Are you serious?
Serious.
24-year-old.
24-year-old.
Wow. So I'm just asking, educate the audience.
Yeah.
If let's say a neighbor or a family member, how do we identify, if a patient is going through this? I know that there is a acronym called FAST.
FAST, yeah.
Can you educate us, please?
See, somebody is being, what I will tell my patients is, when you are known to somebody, you know how they are walking, talking, seeing, okay? When there is a disturbance in these activities, see, that's what we call it as a be fast, okay? Okay, B is like, see, normally you can stand with your eyes closed, okay? You can maintain your balance. Some people can balance in one leg also. So, and this balance will be totally disturbed, okay?
So B is balance.
Balance, okay. E is your eye.
Eye.
What happens to your vision is, either you can have a blurring of vision, okay, or you can have a double vision.
Double vision.
Or total loss of vision.
Double vision is you see
two things. Either it can be horizontal or a vertical on either sides. Okay.
So horizontal means on right and left, or up and down.
Up and down. Okay. And you can have a total loss of vision.
You can see anything.
You can't see anything. Okay. So that is I. E. And fast is
fast.
F is facial asymmetry. Okay, suddenly, normally when we laugh, your lips will be centralized. Symmetrical. It doesn't go on either side.
Correct.
So what happens when one side of the brain is affected, your face moves towards the opposite side.
Wow.
Okay. And that is facial symmetry will be lost.
So that's why you said that right side controls the right brain controls the left side. So let's say that right brain has a stroke, then the left side will not work.
And
So then the patient will deviate to the right side.
Correct. Okay.
Because this side doesn't work.
Doesn't work. So the side which works pulls it.
So it'll be like this.
Yeah, exactly.
Face.
And A is your arms. So there will be a sudden drift, or you will not be able to move at all. Or there can be a simple change like a clumsiness, like whether you can lock or open a door. Only most often the stroke affects the distal part. Okay, so suddenly there will
teeny fingers.
things they'll not be able to pick up a
Grasp
coffee,
it.
grasp it. They'll say, I was totally fine, but there is some kind of a clumsiness in my hand. I'm not able to pick it up fast. Okay, so that clumsiness itself is a sign of stroke. You don't need a major loss. Okay, that can be a TIA where they have that mild clumsiness. They may think it's normal. It's normal to have that clumsiness. Never. And yes is your speech. There can be
slurred speech.
There can be slurred speech.
Aphasia.
There can be a loss of speech, or I can tell this is a car.
Yeah.
Totally, you can
Completely.
Your brain will not be able to pick the objects, and it will see is correct, but when it is coming as an output, it will be totally opposite.
So you look at the mic and you say it's a car.
Yeah. That
But
is-
you understand it's a mic.
understand it's a mic, but when you are processing it out, it comes out as a car.
So expressive.
Expressive office. Then the last thing is a time. When you see all the symptoms, and make sure they go no first aid at all. Please don't do any first aid. That is a major thing.
I've seen people doing first aid.
Yeah. They still give keys in the hand.
When they have seizures, they give keys in the
Keys
hand.
in the hand.
That doesn't work.
That should not be done. It's not like it doesn't work. It should not be done.
So when a patient is seizing or having seizures, it's a common practice to give the keys.
Key, that is in the 70s and 80s movie, which is lived now.
Why it shouldn't be done?
Because what happens is like you do not have a control, your brain does not have a control over your body. What happens is like, so once you're given any keys or objects, you can self-harm yourself. Okay, you can hit, and the movement cannot be restricted. What happens is like, when you try to restrict the movements, there can be a tendon rupture, there can be a muscle damage. So you actually complicate more.
The only thing you should do is to keep the patient on the left hand side.
Pull to the one side
of the body.
So that they do not aspirate.
They do not have the secretions back into the lungs.
Lungs, basically. Yes.
Okay. So what is the time period that patient should get into the hospital?
Hospital as early as possible. It is not like, see, we have a window period of 24 hours now. Okay. You can save them from 24 hours. But for every minute, millions of neurons are dying.
Wow.
You cannot allow it like, I have 24 hours time. Okay, let me not speak for some time.
Right.
So it's not like
earlier the better.
Earlier is the best.
So I'm summarizing. If somebody is seeing, let's say, a patient who has been working night shifts, stressful job, has hypertension for 5 years, and now having some facial asymmetry, not able to speak properly, and eye movement, he's seeing double vision, then we need to rush to the hospital right away.
Exactly.
And usually what happens is that there is a clot in the blood vessel supplying the brain. So there is decreased blood supply to the brain. As a neurosurgeon, what do you do?
See, nowadays, most of the strokes, that is 80% of the strokes are due to clot. There are two myths, okay? Basically, it's even in our state, they say due to stroke, due to paralysis, it is a lifelong dictum. That was the statement till 2012. Okay. So there were not many studies or many interventions which has been there. So now, how do we perform an angio to your heart? We do to the brain.
So it's called angiogram of the brain.
And by reaching your brain blood vessel, we identify which part of the vessel which is being blocked. And going there, it's just like plumbing. Something which has been obstructed, you remove the obstruction and the blood starts flowing, because your brain is only sources your glucose. That is through your blood. If that stops, your entire functions stops and it gets damaged. Once it is damaged, it cannot be reversible. So before it produces a irreversible damage, we go through, it is, see, and imagine it is just 3 mm. Your brain size is 3 mm. And what materials we use is less than that.
Wow.
And we go to and we don't cut open the brain.
It's a
tiny material, we call it catheters. Okay, just like imagine
like for
a layman, just imagine like an IV line which has been placed in your hand. How thin an IV line?
Correct.
Exactly same thing, we'll place it in your hand or through the leg. That's called as, we call it femoral artery.
Angio.
Through that we reach the brain where it is blocked. Once we identify the block, we use the catheters and we call it as a stent. We remove those clots and immediately we see the perfusion of the brain.
Wow, it's like a blocked pipe and you remove the clot, the blood flows
back.
That's so rewarding.
It's not only that. You see, I have around more than 100 patients where they have been completely paralyzed and gone back to their normal routine life. Plus, they have been doing the extra physical activity before what they were doing.
Wow. Before, for stroke, they say, as you mentioned, it is really worse than a death sentence.
Exactly. See, always people say death is the worst thing which can happen to anyone. Okay. But actually, stroke is worse than that. There is a Tamil movie also in Theri. That is what a stroke is.
Wow.
See, what happens is, when you're there, when you have all the functions, when you have enjoyed all the functions, you never realize, I am seeing, I am talking, I am listening, I am being creative, I am singing, I am dancing. And we never appreciate or we never credited anything. And it's like a computer, and even more we are being more creative and we are adding.
Correct.
And we never thanked or realized, it's like, we think it is normal, fine. But suddenly, when they put 2-3 plugs out of you, and you don't have your creativity, neither you can speak, and your right hand and your leg function is gone. That's when it's very hard. And you have to be dependent for everything on your other people. And it is worse for the family people also. See, death is like they are died.
Correct.
And here they are being responsible, and every time it takes a huge toll on the family as well as on yourself.
And they feel it's very bad for them.
Yeah, exactly.
So tell me a patient experience that you may have had.
Yeah, I have a beautiful experience. See, especially certain adult, one of my patient, okay, he was a chronic alcoholic, never listened to his wife, okay, and he was a smoker. He was around 35 to 36 years age. And whenever his wife stops, I know I can consume alcohol, I know I can, suddenly that male bravado steps into him and says, don't advise me. I know I can smoke till 90 years, I'll be fine. And alcohol I can consume, I'll be fine. Please don't advise me. And there was a literal abuse, everything was there. Okay. And this was a long history he had, and along with that, uncontrolled blood pressure. His wife was pregnant, and at almost 20 days to her delivery, he collapsed suddenly. And she couldn't realize what was happening to him. She couldn't process. She was thinking, he fell down, probably I'll put a sugar on normally people do, no? Because hypoglycemia is one of the commonest cause where people suddenly fall. And she also did all the first aid. He was not improving at all. He started slurring and his right hand was not moving at all.
So he was having the fast signs.
And immediately she called a neighbor. They said, and they were good, they were educated, and they said, immediately we'll take to a nearby hospital, stroke center, where what we can do, we'll see him. And when they came, we saw the blood vessel to the left side of the brain, which was completely blocked. We did a CT and we usually do an angiogram. CT angiogram. So once we see it is blocked, luckily they came within 4 hours. So what we did is, immediately we took them to the angio suite and we saw which vessel was blocked. And immediately we went there it was within like the around 1 hour, we removed the clot. And what happened was, the next day itself, he started speaking and his functions restored.
Wow.
And the first thing he said, he prayed at his wife, saying that, thank you so much.
Wow.
And everybody doesn't get the second chance. Okay, not every people gets this second chance. Very few people are lucky to get this second chance. And if you are lucky, make sure you do not repeat that mistake. And now he realized, and he's totally like, even if you ask him to take sugar, he will not take. He's become that.
Do you think the stroke could be related to the alcohol use as well?
Definitely. Alcohol, smoking adds. It's like you put the time bomb to you and go walk whenever it bursts.
What does alcohol do to the brain?
So what happens is, like, when you consume initial alcohol around 30 to 40 ml, what happens is, like, there is a sudden spike in the dopamine. So, and you feel elated, okay, and elated. And the moment you get elated, after some point, the inhibitory reflex goes. And you speak whatever you want. You will be so free. And they say that it is detox, okay. And after a point, what happens? It produces a state where they become depressed. The same alcohol, after a certain quantity, it causes depression. And what happens is, like, over a period of time, they don't want the depression. They want again go back to the elated
dopamine,
elated mood. So again they start consuming
at a much higher level.
At a much higher level. At a certain point, everybody will say that I know I can control myself.
Correct.
That is a very wrong statement most of them make. 90% of them cannot control, but they say they are in control. They say, I'm in total control, that I can say I'll have 30 to 40 ml per day, I can control myself. But 90% of them, they'll cross beyond that. They cannot control, because what happens is, like, your dopamine surge is gone. So when you're going for when you're going for a easy fix, what happens is, like, you'll again go for the easy fix. So again you'll go for the alcohol to go in for a dopamine surge. So what happens to this? These alcohol will keep damaging your vessel wall. Okay, it's not only
the 3 millimeter wall.
It keeps producing an inflammatory state to your vessel wall.
So then 3 millimeter will go to 2 millimeter.
2 millimeter. Once what happens? That's where your cholesterol keeps. Once the vessel is damaged, the
cholesterol gets accumulated.
They get accumulated, and they form a plaque.
So the blood supply decreases. And once such plaque can be here, that's what we call as a carotid artery disease. Right. And these plaques can enter into your brain, which can produce a stroke. So technically we're saying alcohol can cause heart attack of the brain.
Definitely.
And also obesity is also linked with stroke, correct?
Definitely. Definitely. What happens is, like, see, your obesity, your smoking and drinking. It's
like a multifactorial.
And more you're on the sedentary side, definitely you're at a higher risk.
If you're not moving properly.
So that's what I'm saying. You move, you get your dopamine rather than drinking. You move, you make a movement, it produces dopamine. Most often, whenever you are in stressful situations, or whenever you are in an anger or anything, that's what they say, never take any decisions when you are in anger. Because what happens is, like, your brain doesn't react, it reacts very impulsive. So it's only your emotional center takes over, not your logical center. Logical center never works. It's like, most of the world war started because of your emotional centers. Not because of logical centers. So we will react very impulsively. So for your impulses to act, you have to be normal. For that, a minimal movement, you just walk away from that side. For even 100 meters to 200 meters, your distance will be different. There will be a dopamine release will be there, but we are not ready for it. Why to walk there? I'll just take a
So whenever you're stressed out, take a walk. It's always
definitely. Or take a deep breath. If you are even more lazy, take a deep breath. It goes into the parasympathetic activity. It's even more your stress hormones
Right.
goes
So when you
down.
take a deep breath, it simulates something called parasympathetic
Sympathetic
nervous system, which
nervous
slows you down.
Down, exactly.
So hopefully it'll bring it back to your normal routine.
Normal level.
I see. Yeah. What does obesity actually do to the brain? Does it cause inflammation in the brain?
Definitely. It produces enormous amount of inflammation to your brain.
And all brains are like small vessels.
Exactly. The same thing. All the inflammatory particles will get deposited on the vessel wall.
And then decrease the blood
Decreases
supply.
the blood supply.
That's why they call microvascular infarcts.
Infarcts. So small, tiny.
Explain that to us. Educate the audience. What is microvascular infarct that is seen in obesity? It's a very important point.
See, what happens is especially elderly age groups, okay? There are people who suffer from memory loss. Okay,
Yes.
correct. And everybody thinks it's aging. It's a part of aging. There is a big term called as vascular dementia. What you mentioned due to the microvascular infarcts. So what it does, these small blood vessels, what I was telling, they get deposited by these cholesterol
particles.
And these infarcts, they are all silent infarcts.
So infarct means an area where there is no blood supply.
Blood supply is being done.
And microvascular is because of
once from the larger arteries, when you are going into the end organs, the size gets smaller and smaller.
And brain has so much amount of smaller blood vessels.
Smaller blood vessels. When that gets infarcted, they do not produce a strong sign like a limb movement or a speech. They'll have these subtle changes where they'll have a sudden mild imbalance and memory issues. And when you get a scan, you will see small infarcts everywhere.
So even without our knowledge, there could be some infarct that's going down right now.
The brain.
I see. Wow. So is that the reason that can be related to dementia?
Definitely. That's what. See, all these infarcts invariably what will happen is there is a process in the brain where your memory gets stored. Correct? And there are various segments of memory. What happens is these micro arteries supplying to those segments gets blocked over a period of time. And they'll think it is normal to forget. And over a period of time, it will be so vast, they'll not be remember where they're navigating inside their own house. Like for example, I have to go to a toilet, I'll not be knowing the pathway where I'm going. And suddenly I'll be forgetting my kids' names. When they go to that extent, only they come to us. So, sir, this was very small issue, but
and you see this commonly.
Yeah, very common. So vascular dementias are becoming more and more common nowadays. Age group
40, 45, 50?
50 to 70, somewhere there. I get to see these cases often.
Wow. What can one do to prevent it or maybe improve the memory and focus? Of course, losing weight, being fit.
Yes. See, memory is something which is trained. Okay. See, some people, they say, we will never pick the 5% individuals who has a photographic memory. Okay. So never pick them and say that, tell your kids, see, that kid is reading for once and he's telling it to, it's like a parrot memory. Immediately he's saying what happens, you never do that. See, the main thing is memory is a reinforcement. We call it as a Pape circuit. Okay. There is something called as short-term memory, something called as a long-term memory. Yeah. See, short-term memory is like 5 given things. I place it over here and I tell you these are the things, and suddenly I take it away and I'll tell you to recall. That is called as short-term memory. Something which is like long-term memory, which is going to be everlasting for you. So what happens is you need to study again and again, remember again and again. So that's what I tell most of my patients or the kids, they'll say, sir, he has a very bad memory or something. What I'll tell them is the easiest way is to ask the kid to learn and ask that kid to teach the other kid. What happens is he learns it, he reinforces it in his brain, and again when he teaches, again it goes enter into the Pape circuit again and again. So invariably, he would have, once if I am telling something to Dr. Pal, I should be confident of what I'm saying. I should have memorized it. Then I'll use my creativity to explain it. So many centers I'm using it to tell it to you. Tell it to you. So once I'm sharing this knowledge, once I'm telling it to you, it means multiple times I have revised in my brain to tell it to you. So you study that. That is why there is no escape from the hard work. You always keep reading, and once you read, try to teach others so that your brain is reinforced and your prefrontal cortex will be very confident. It will say you are confident about that subject and you will never forget. It will give your confidence level. And once you are doing it, even in your exams, you will be so confident in approaching. You will not be taken back like, oh, it's a difficult question. No.
So repetition.
Repetition is the most.
That's what they say, learn, do and teach.
Teach.
Learn, do and teach. Is this the same concept called neuroplasticity?
Exactly.
Where the neurons are malleable.
Exactly.
We talked about obesity causing inflammation, causing microvascular infarct. A person listening to this podcast, maybe they are overweight, maybe they are obese, they want to lose weight. Everybody has gone through the weight loss journey. You are Mr. Chennai. You look really fit. You have gone through your journey as well. So what will you say to that person who's trying hard, but he is not able to build up the discipline? And how did you build up the discipline, and what should we do to the brain?
You need to break up a very long cycle, basically. What happens is like, see, what they tell you in childhood, they'll put you rice, they'll feed you more, even when you say no, correct?
Yes.
Most of the mothers tell that. And it is been installed in your brain right from your kids, okay? And you want your kid to look chubby. Okay. And if they look lean, it means they are malnourished. Correct. No? There is a difference.
Correct.
And you keep training your brain right from your childhood days. Okay. Then what happens? Your social friends and everything connects over there. And again, nowadays, with all the junks which is coming in, that also gets incorporated into it. Okay. So you have a long history of you've been fed like you have to eat more. Okay. Then this social elements also added to it. And you added junk to the natural food which has been environment. So what happens is like you have been trained your brain for almost 20 to 25 years in that way. And suddenly once you are processing whatever you have done is wrong, suddenly you try to deviate from it, your brain will not accept it. Okay. So what happens is like there is one structure of the brain which will say no, and there is something called as emotional center. You are so emotionally connected. When I say biryani, you will be so happy. Yeah, I'm so happy.
Where is that emotional center in the head?
It's in the limbic system.
Limbic system in the back of the brain.
Back of the brain. Okay. So you are so emotionally connected towards the food, and suddenly when I say like you limit your food and you limit the junk, which is you've been happy with this, okay, and suddenly you realized this happiness is not right for your body, okay, and you're trying to break it. What happens is like this limbic system is the strongest for every human being, correct? Because it's the oldest brain which has been formed.
Correct.
Yeah. And this never allows your prefrontal, which is your subconscious, telling you not to do.
So the subconscious mind is in the prefrontal. This which is supposed to make you do the right thing.
And it will never allow. Why you want to break it? You have been happy all this time. You've been feeding happy.
Limbic system telling you.
And you've been not exercising. Why you want to do this? You please be happy. It's okay to be like this. And why you want to break it? You just do not do. And this prefrontal cortex, it has to coordinate with the basal ganglia to make a repetition. But this limbic system is not allowing the marriage between the prefrontal and the basal ganglia.
I see.
It is trying to separate these two centers. Do not get into this. You have been happy. Never go through that torturous life. These two are like, no, this is what is good. You have to allow me to. So it is not like external factors are pulling you out. Inside your brain itself, there are two factors trying to...
It's like a war.
Which has been happening. So what happens is like, for this war to end up in a good marriage, what should happen is like your prefrontal should start listening to your limbic system, and limbic system should listen to your prefrontal system. for that to what you should do is, you should do something. For example, I'm trying to do weight loss. Tell your prefrontal that tomorrow morning I'm going to get up at 5 a.m. And make sure you tell it to your parents and to others also. So what happens is, like, there is something called as guilt which produces in the prefrontal cortex.
So guilt is produced in prefrontal
cortex. So what will happen, it will try to disconnect with the limbic system for some time. So use this time and try to go towards, for example, you're starting your day one workout. You're starting it. What happens is, like, once you have broke the chain, and once you've gone into that system, there is some amount of dopamine release will be there. Again, what happens when you're going to the next day, this limbic system again it will start. Do not listen to the prefrontal. You are happy like this. You are eating chocolates. You eat more chocolates, you will be fine. But what will you make the brain accountable? Make sure you tell them, no, I have told so many people, and try to involve some positive attitude people towards you. And make sure your surrounding is also very important. For example, you are having a good coach or a good partner, okay? And he tells you, morning I'll call you, please come, we will work out better than yesterday. So this sends an impulse to your prefrontal cortex, and make sure it goes that way. Once you start doing that for almost 3 to 4 weeks time, once they see the body structure is being changed and you've been healthy and so much of clarity in your professional as well as personal. Okay. Once this has come, what it will happen is, it will tell the limbic system, prefrontal, see how much we have changed. Now the limbic system will start loving
Doubting.
this. See, oh yeah, yes, I look good. I look better. Now yes, we need to stick on to this rather than to that. For that to develop, it takes a process. So never allow somebody, see, for example, you're getting into this pattern, okay? Suddenly, friend of yours sedentary meets you and say, "Oi, come, we'll chill. We'll have a drink. We'll take a cigarette." Everything goes away. Again, your limbic system, it has a huge memory. Yes, what he's saying is right. So that's what I'm saying. So never allow these things to settle in. Always, once you decided to change, go for a positive attitude, and as well as your fellow beings and your family should also be supportive. Asking, see, yesterday you went to gym, right? Today what happened to you? Where you are? And you look better. See, these things, what will happen, it keeps ensuring your prefrontal cortex takes over.
So summarizing is like repetitiveness,
Yes.
being in a positive environment, and having somebody push you and being accountable for.
Exactly. And one more point. See, most often what happens is, like, there will be a point for any physical activity or anything, there is something like they'll feel monotonous or they get bored of that activity. They'll stop. For example, I am going to a gym or lifting so many weights, or I'm running for 5 kilometers. They'll suddenly, no, today. But sometimes you don't need to do that 5 kilometers. At least go there. Wear your shoes. Go there. What will happen is, eventually you will do. So do not, and always tell your brain that, cheat your brain that I'm going to be very specific for tomorrow. Tomorrow I'm getting up and at least I'll be landing up in the gym. That is what we should not tell that immediately. Limbic system will say, why you have to run tomorrow morning 5 kilometers? Just sleep, no, it will be better. Instead of that, just wear a shoe and go to the gym. That should be your primary. Just have a small cues and small tasks rather than a big task at a single moment.
Correct.
This will definitely help you. What will happen? Immediately you will land up in the gym. You will not be silent. Immediately you will start working out. Immediately that laziness, immediately it will go. And you will eventually do the entire workout or entire session.
Wow. It's so scientific, and if it happens, the person will be really happy.
Really happy. And end of the day, they say, hey, I eventually did.
Correct. They'll be surprised.
They'll be surprised. And they'll be like, oh, I was initially so tired. Now I did the entire process. It is no matter what, do not break the chain. At least go to the place where you have been working out or running, jogging, whichever physical activity. Please go there. Wear your shoes, go there. Then doing and not doing, it's a different part. The brain keeps taking over. But stopping it at home itself, which is being the primary cause for not going for a longevity of this process.
So it was a wonderful discussion. Okay, thank you so much. But we have some rapid fire questions for you. Okay, so the answer should be yes or no, and then a little bit of an explanation. What do you think? Number one, listening to classical music makes you smarter.
No.
No. Okay. If you have big brain, more intelligence.
No.
No. Size of the brain matters.
Matters, but
Not directly proportional to intelligence.
Intelligence.
Once brain cells die, the brain cannot recover.
Yes.
True. Okay. Forgetting things sometimes means Alzheimer's dementia.
No.
We talked about the microvascular
dementia. See, forgetting things, every day we forget. Okay. See, they're saying forgetting things is a disease. No. You should, it's like brain is like a storage. Certain things has to be forgotten. See, for example, you have a bad past and you have a bad memory, like which has been happened, or one thing which has been happening in your life. And if you're not able to get over that, what will happen? You cannot be stuck, so forgetfulness is not a disease. At the same time, when you call it as a disease is when you're not performing your routine activity and you're not able to perform, you're deviating from your routine activity where there is a literal, you're not able to navigate your own home, where you're not able to recollect your expenses and you're not able to recollect your own relatives.
Where you park the car.
So these are the alarming signs where you need to be on check.
Super. Crossword puzzles can prevent dementia.
Yes, to an extent.
It can help.
It can help.
Yes. Memory loss is just normal aging. Nothing can be done.
No, definitely it is a preventable one. Preventable one. Memory loss is definitely a preventable.
Stimulating your brain.
Definitely.
With Sudoku, puzzles.
Everything, reading books. And learning new things. Even it's not only reading, new skills. Skill sets. Once you're learning a new skill set, even a new sport, your coordinatory skills, everything. So it is not only reading, even and learning a new sport will always helps you.
Wow, nice. Video games cause long-term brain damage.
Yes.
It does.
Yes. Constant exposure to the video games. Yes, definitely. There are scientific evidences which has been causing a harmful effects on the brain.
So a person listening to this podcast, if the kids are playing video games a little bit, it's okay.
Yeah,
But
once in
not
a while it's okay, but on a long term, yes.
Left brain people are logical, right brain people are creative.
Yeah, but to a certain extent. But both people are...
they can, as you said, you could train both minds.
Yeah.
Okay. Cracking your neck can cause stroke.
Yes. No, most of the chiropractors, we have a term called as dissection. So you're never supposed to crack your neck because see, nobody knows the anatomy of your own body. So you do not know how your vertebral arteries or your carotid arteries, how fragile it is.
Vertebral artery is the blood vessel that is going through the spinal canal.
Spinal canal to your brainstem. That is your back of the brain. Okay. So once some patients are genetically predisposed, once they crack the neck, they can rupture the artery, which is so many massage center, chiropractic centers, where they would have suddenly cracked the neck, they would have changed the neck posture. Suddenly what will happen? They'll have a dizziness, they'll fall unconscious and they would have been paralyzed. What would have happened is that their arteries are prone to rupture. Okay, they will be easily dissected. Certain individuals. So we cannot.
Yes, we don't know.
We don't know. Nobody sees the artery.
Correct. Yeah. It is just a
it is inside
procedure.
It's inside your system. Nobody know your artery is fragile or not.
Correct.
So generally avoid it.
You can improve your IQ with brain boosting supplements.
No.
Stroke happens only to the elderly. That we talked about.
Yeah.
As young as 24.
24.
24-year-old. Wow. Such a wonderful discussion. Oh my God, I learned a lot. Thank you so much. Thank you so much for your time. One last thing that you would tell my audience if they have to improve the brain health, what would you say?
Sleep early. Avoid alcohol. Avoid cigarettes. Exercise at least 4 to 5 days a week. Eat healthy.
Nice. Super, super. Thank you so much. You've been wonderful. Best wishes for all your future endeavors. You're doing a Chennai Stroke Society. I'm very, very happy. Whatever you do, best wishes for you.
Thank you so much.
Thank you. Thank you.